Treatment protocols and parameters. We have already covered the role of bar and frequency in creating the desired treatment effects. This section will provide example treatment parameters to use for a variety of conditions. As we talk through these example treatment protocols, please note that these are general examples. Clinicians can adjust the treatment parameters based on patient tolerance, device type, and local practice guidelines. In the example of plantar fasciopathy, the energy delivered would be somewhere between 1.5 and 3.5 bar, using a frequency of 8 to 15 Hz. The total number of shocks delivered in a session would be 1500 to 2500. It is recommended that 3 to 5 sessions are completed. Please note, start with a moderate level of bar and frequency, and these can be increased as tolerated. Combine these treatments with stretching and orthotics. Achilles tendinopathy. Use 2.0 to 3.5 bar and 6 to 12 Hz for 1500 to 2500 shocks, with 3 to 5 treatment sessions spread apart weekly. Focus on mid-portion or insertion and combine with eccentric loading exercises and heavy slow resistance. For tennis elbow, use 1.5 to 3.0 bar, 8 to 12 Hz for 1500 to 2500 shocks. Again, use 3 to 5 treatment sessions and apply to the tender area and muscle belly if needed. Make sure this is combined with strengthening exercises. For patellar tendinopathy, use 2.0 to 3.5 bar, 6 to 10 Hz for 1500 to 2500 shocks. Deliver these over 3 to 5 sessions and focus on the tendon origin and insertion and combine with eccentric exercises such as squats. For calcific shoulder tendinopathy, the bar is 2.5 to 4.0 and the frequency is 4 to 8 Hz. Deliver 2000 to 3000 shocks. 3 to 6 sessions might be required. Use a higher bar setting and lower Hertz for more intense treatment to try and break the calcifications. Combine this with range of movement and rotator cuff rehabilitation exercises. Greater trochanteric pain syndrome. Use an energy of 1.5 to 3 bar and a frequency of 8 to 12 Hertz. Deliver 1500 to 2500 shocks in a session and treat the patient over 3 to 5 sessions. Use this to treat the gluteal tendon insertion sites onto the greater trochanter and combine the treatment with hip strengthening and general loading exercises. Here are some key evidence-based notes for the treatment protocols and parameters. Typical treatment ranges: bar 1.5 to 4, frequency 5 to 15 Hz. Remember, lower Hertz equals slower delivery and more force per pulse. Shocks 1000 to 3000 per session, depending on area size and goal. The treatment parameters can be manually selected, or many radial shockwave therapy devices have preset condition-specific parameters which the clinician can choose to use. Sessions, usually 3 to 6 weekly sessions, sometimes spaced 1 to 2 weeks apart for larger calcifications. Combination. Research strongly supports combining radial shockwave therapy with a targeted exercise program, especially for tendinopathies, such as eccentric exercises for Achilles or patellar tendinopathy. There is strong evidence supporting the use of radial shockwave therapy for plantar fasciopathy. Calcific shoulder tendinopathy also has strong support, as it is good for breaking down calcium deposits. For tennis elbow, Achilles and patellar tendinopathy, there is moderate to strong evidence supporting the use of shockwave therapy, but it is best suited for chronic cases. Effect. Maximum benefit is often seen 4 to 12 weeks after the final session, due to tissue remodeling, which continues for several weeks after the final shockwave therapy treatment session. Some practical tips. Always start at a tolerable bar and increase over sessions. Higher bar results in more depth, lower Hertz results in slower delivery and more impact per shock. Expect mild discomfort, but adjust the treatment parameters if the pain is excessive. Avoid high bar over superficial nerves or bony prominences. The information presented within these slides should act as a useful resource for treatment parameters, but the International Society for Medical Shockwave Treatment also have a clinical guideline which also includes condition-specific treatment parameters. Thank you for your attention. If you are considering adding shockwave therapy to your clinic, please get in touch with the team at Eureka, who will be happy to discuss device options and implementation strategies.